Good morning, Mr. Smith. I'm Amanda. I'm going to be your nurse today. So I'm going to be doing your trach care. We're going to do some suctioning, and I'm going to do some cleaning of your trach. If you could be so kind as to verify your first and last name and your date of birth. Wonderful. All right, so I brought in my supplies, and I'm going to make sure I have my hand hygiene close to me. So first we're going to suction you. And I am going to hyperoxygenate you. You're currently set at 2 liters per doctor's orders. I'm going to go ahead, I'm going to turn you all the way up to 10 for now. And I'm also going to turn on suction to 100. All right, so while you're hyperoxygenating, I'm also going to be bringing you up into a higher position to save my back. So we're going to move you up into a higher position, as well as repositioning your head just a little bit and bring you to a higher position. There we go. So first we're going to do your suctioning. Open up my kit and get my sterile water into my container. I'm going to place this across you just to catch any secretions. There we go. Okay, so then I'm also going to get my gloves out. Okay, so I am now sterile. And I am going to actually be suctioning with my right, so I'm going to use my left as my dirty. So I'm going to go ahead and grab catheter because I'm still sterile, so I can still do this. And I'm going to attach catheter. I should have measured this beforehand, but I didn't. Suction, all is well. All right, so I'm going to go ahead and I'm going to remove your oxygen now.
The CNA will fix it.
The CNA, if you could please fix it, that would be great. All right, and then I'm going to go ahead and bring your settings back down to 2 liters per doctor's orders. And I'm going to measure at the 10 mark, which is about 5 inches. And we're going to insert, and then we're going to intermittent suction coming up while swirling. Great. Feeling better?
Yeah.
Good. All right then. Now that that is completed, CNA Alyssa, if you could assist me.
There we go. I'll put the oxygen back on.
You just put that over his head. Great. Put it on upside down. There we go. Okay. There we are. Now that I'm completed with that, sterility is no longer necessary. Okay. Now that we are done with that,
how many hands do I have? Okay, so I take the oxygen with myself, then I'm
I'm going to go ahead and perform hand hygiene again. And CNA Alyssa, could you hand me a set of clean gloves? Medium, please.
Yes.
Yeah, just because you don't want to like valves. Yeah, your heart has like valves. You don't want to like close. Yeah.
wonder where CNA Aubrey went. That would have been helpful.
She's on her lunch break.
Ah,
You know how she loves her lunch breaks.
all right. So I'm gonna go ahead and remove that,
And then I'm gonna use my hot brand.
and we're gonna do trach care now. So I'm gonna leave that there while I'm getting set up.
Okay.
And also like make sure there's no blood clotting. So you just say I'm gonna do separate.
I have my sterile gloves.
You could just say half that.
Just do it.
So we're gonna go ahead and we're gonna put your field down.
So don't flush the whole thing.
Here we are.
I'm leaving a few mils.
And
A few cc's and then full
I
out.
have my sterile water
Is it trash?
with my,
Which one goes with those? This one?
Yes, this is sharp.
Okay. And then now I take and do 3 pumps.
And then you would say
I'm gonna have to start over.
Well, before I pump.
Go.
Okay. I'm gonna go ahead and I'm just gonna remove your oxygen here. And I'm just gonna place it on the blow by and just keep it kind of right. Sometimes you tubing, there we go. So place that right there. Okay. Then I'm gonna go ahead and remove your old gauze.
That was much better.
Okay.
Okay, so this way.
And then I'm gonna put on my sterile gloves.
I'm assessing the underneath the instructions. I'm assessing.
and then you're gonna say that this is kind of like
How does it measure? It doesn't work, right?
Okay. And I'm gonna remove your old cannula. Okay. And we're gonna throw that one away. And I'm gonna replace it with a brand new cannula. There we are. Okay, so now I'm going to use these Q-tips and we're gonna clean the skin around your stoma. Wipe once, throw away. And that was to the left of the stoma, and then we're gonna go to the top. Once, throw away. And on the right side, once, throw away. And on the bottom, wipe once and throw away. Okay. And I'm going to use these gauze and fold it in half. I'm going to clean and clean. All right. There we go. And we're going to do your new dressing. Get it out. We don't want any wrinkles or any bumps.
We actually have the real.
Don't want any skin breakdown.
Oh, we almost done.
And 'cause I still have
No, I have to do my dressing
your
change.
ties to
But then
replace,
we're gonna go on the straight.
I am going to hold your trach.
But we did pretty good on it so far. Yeah. We actually attached the real standard.
Those ties.
Just to go like what we're doing.
Okay.
We should have put it on.
Around your neck. Push that.
We're gonna get it on.
you can just pretend to and then just like
Okay. Sure. Just get like our own tab. We're getting it on.
I know. The Velcro ones are much simpler. I agree.
I got these tracks. Like our two did over
right. Okay. And make sure you put your oxygen back on you. There you are. And it is set to 2 liters, just like doctor ordered. All right, Mr. Smith, you doing okay?
Yes, thank you
Great.
so much.
All right, so I'm gonna go ahead and bring the bed back down to the low position. And I'll bring the head of your bed down. All right, you're all done, Mr. Smith. Enjoy the rest of your morning.
I will.